My name is Milinda. My son Andrew has severe hemophilia B. We switched to IDELVION August 2016. I'm a mom and I'm gonna worry no matter what. And Andrew's 15 years old and he wants to do everything. But as a mom, I'm always gonna worry about him. Finding Andrew's diagnosis was really challenging. We finally went to the hospital to get tested. The doctor, the hematologist, and the nurse were looking at his bruises. I was thinking in my head, my son doesn't have hemophilia. A week later, I get a phone call. In an instant, my life changed. I just thought, how am I gonna take care of this baby? How am I gonna know when he's bleeding? What do I have to do to take care of them, to protect him and keep him safe? My motherly instinct said, I have to do something about this. I need to help my child, I need to protect my child, I need to keep him safe, and I'm gonna do everything I can. So I just had to pick myself up and just say, I need to take care of my son. I need to learn more about hemophilia, and that's what I did. I had the nurse come out and do his infusions so that I can learn how to do it myself. After I learned how to infuse my son and I got the control back, I felt empowered to protect my son and keep him safe. So when Andrew first started getting his infusions, he was on a short-acting medication, and he was on it for about 10 years. It just didn't do enough for us. So then we switched over to a longer-lasting factor product, and he responded okay in the beginning, but then came more challenges. My doctor wanted to put us back on the first product he was on, and I didn't want to do that. And I said, don't worry, Andrew. You know, the scientists are working on something. You're going to be okay. I promise. Mommy's going to help you, and we're going to do something about it. And we were at the symposium. We approached the booth, and I looked at Andrew, and I said, Andrew.
Remember when I told you that the scientists are creating new medicines?
Well, this is it. It's IDELVION.
When she said that to me, that's when I started to break down in tears emotionally.
Because he was so excited. He knew what it meant. He knew.
And I thought, wait, maybe this could, this could really affect my life in such a positive way.
And that's when our lives changed forever. Since Andrew started IDELVION, he's able to be more active. We're not worrying as much about what he's doing. I don't have to travel as much to the doctor's office or hospital visits. It's just simply changed my life.
It's good, when you feel protected by IDELVION.
As a mom, I'm always gonna worry about him, but I still feel an incredible sense of relief. Now that Andrew's on IDELVION, I have time to take care of myself and I can breathe again. He's finally getting the protection he needs.
Important safety information. IDELVION, Coagulation Factor IX Recombinant Albumin Fusion Protein rFIX-FP is used to control and prevent bleeding episodes in children and adults with hemophilia B. Your doctor might also give you IDELVION before surgical procedures. IDELVION can reduce the number of bleeding episodes when used regularly as prophylaxis. IDELVION is administered by intravenous injection into the bloodstream and can be self-administered or administered by a caregiver. Do not inject IDELVION without training and approval from your healthcare provider or hemophilia treatment center. Tell your healthcare provider of any medical condition you might have, including allergies and pregnancy, as well as all medications you are taking. Do not use IDELVION if you know you are allergic to any of its ingredients, including hamster proteins. Tell your doctor if you previously had an allergic reaction to any Factor IX product. Stop treatment and immediately contact your healthcare provider if you see signs of an allergic reaction, including a rash or hives, itching, tightness of chest or throat, difficulty breathing, lightheadedness, dizziness, nausea, or a decrease in blood pressure. Your body can make antibodies, called inhibitors, against Factor IX, which could stop IDELVION from working properly. You might need to be tested for inhibitors from time to time. IDELVION might also increase the risk of abnormal blood clots in your body, especially if you have risk factors. Call your healthcare provider if you have chest pain, difficulty breathing, or leg tenderness or swelling. The most common side effects of IDELVION are headache and dizziness. These are not the only side effects possible. Tell your healthcare provider about any side effect that you experience and contact provider immediately if bleeding does not stop after taking IDELVION. Please see full prescribing information for IDELVION, including patient product information. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. You can also report side effects to CSL Behring's Pharmacovigilance Department at 1-866-915-6958.